But speaking of concern, let's begin this hour with the latest on the monkeypox outbreak, which the White House is now calling a public health emergency. The goal is to make vaccines and treatments more readily available. The virus has been detected in all but 2 states, and the number of infections is rising rapidly. More than 7,000 cases have been reported across the U.S., and health officials warn that that number will go up as testing improves. Dr. Ashish Jha is the White House COVID response coordinator, and he is also assisting the response to the monkeypox virus. Dr. Jha, how are you doing? Good morning.
Good morning. Thanks for having me here.
Now that this is declared a public health emergency, what changes when it comes to monkeypox?
Yeah, it's one more tool in our toolbox of all the things that the administration is doing to ramp up the response, right? We just named 2 key national leaders to lead the response out of the White House, one from FEMA, one from CDC. The public health emergency allows us to speed up vaccines and treatments more effectively and efficiently. That's going to be helpful. And also helps us get data collected better across the country. So there's a whole set of tools that the public health emergency gives us that allows us to be even more effective in this response.
Dr. Jha, you said a couple of weeks ago on Face the Nation, we think we can get our arms around this thing. Where are we on vaccines, and how are you prioritizing them?
The goal of this is still to eliminate this virus, to get it under control, and to ultimately eliminate it. In terms of vaccines, we have substantially ramped up both vaccine acquisition from abroad. So there's one small company in Denmark that makes these vaccines. We have gotten more vaccines than the rest of the world combined. And we're primarily targeting those vaccines to the community where this virus is spreading, which is largely among gay and bisexual men who have sex with men. That's where the virus is spreading. And that's where most of the localities, most of the cities and states are getting the vaccines out.
Somebody watching right now may think, okay, we have roughly 7,000 cases in the country. Based on what you just said, is this a bit of an overreaction? Are we pulling the fire alarm, so to speak, declaring this massive public health emergency when it's not as much of a threat to everybody around the country? Your reaction?
Yeah, I would say 2 things. I mean, first of all, thankfully, no one has died, so we are still at a point in this outbreak where I do believe that while it is very, very serious, it is not something that is a reason for widespread alarm. But look, public health emergency gives us some tools that lets us get on top of this thing. One of the lessons we learned from COVID, one of the lessons that we learned from all outbreaks, always better to be a step ahead of the virus. And that's what we're doing here. We're taking this very, very seriously. It's obviously affecting a specific community. We're working very closely with that community. I think this is absolutely the right and appropriate approach. It will allow us to give us even more tools to get on top of this virus.
Dr. Jha, where are we with antivirals?
Yeah, it's a very good question. There's one treatment called TPOXX. It is actually a treatment for smallpox, has not been authorized for monkeypox. FDA is looking at that, collecting data. The good news, again, our administration was prepared. We have 1.7 million doses of that in the Strategic National Stockpile. We're going to be studying how well it's working. We're still getting that out to people, looking at the data, making sure it's safe and effective. We believe it is. All the data so far says it is. And the goal is to make sure that those antivirals continue to get out to people who are infected.
Dr. Jha, there is a lot of confusion on how this virus actually spreads. The CDC says you can get it from touching objects or even fabrics, which is all of us every single day. Can you clarify that?
Yeah, look, there is a theoretical risk, and then there's the reality. I mean, theoretically, sure, it can spread through those mechanisms. But when you actually look at the data and say, how is this virus actually spreading? Right, 98% of the cases so far have been among gay and bisexual men. It is largely spreading through prolonged skin-to-skin contact.
The reality is a lot of people want this vaccine. They want it now. So if you go out today, long lines are already forming. Where can you get it, and how fast can you get it?
Yeah, so we're getting it out to localities. I mean by that, cities and states, right? And they're making the determination of where, which communities. But I want to, again, re-emphasize, to me, the most important thing is that this vaccine get out to the communities where the virus is spreading, and that is, again, among gay and bisexual men. And that's what most communities, that's what most localities, public health departments, that's the group that most of them are targeting, and I think that's appropriate. I think that's where vaccines should be.
But where's Dr. Jha? Specifically, you're speaking to several million people right now. Where can folks get this vaccine?
Yeah, so again, different public health departments have set it up differently. I would look up your local public health department. Almost every state has a website on monkeypox. You can go to that. It'll tell you where vaccines are available. Every jurisdiction, every city, every state in the country, certainly every state in the country has been allocated vaccines, and they have all set up their own places of where they're getting these vaccines out.
We appreciate you always being here when we need you. Dr. Jha, thank you.
Thank you.